Thank you very much. I've come up here with my bag, so if anything you've heard is really boring or doesn't interest you, you've got that to look at, okay? Now, from me, you've got how many? 11 slides in 15 minutes, and I will not be talking to the slides, and I've tried to make them very data light. What can be done, the HIV criminalisation of people living with HIV, and I'm looking specifically at non-disclosure, exposure and transmission, or allegations of. I'm trying to set that within a slightly wider context. And in terms of what can be done, I think we've got a lot of different actors in the room, and I hope we can pull out some of the different things for different actors. But first of all, for those of you who don't know, we have... That's who we are, the HIV Justice Network. If you don't know us, this is what we try and do. We're very small and lean. We only have six staff, full-time equivalents, but we work with 7 key organisations on 4 continents, and we work with a much wider HIV justice-wide coalition, 1 or 2 of whom are in the room here at the moment, of our members. So that's what we do, and this is what we try and do, building the evidence base. Evidence and data is everything, as we know. Provide advocacy tools and resources which are context-specific, but also have a universal application. Raise awareness of the harms of HIV criminalisation, which we see very much as a surrogate marker for an awful lot of other things. And as you will see, there might not be that many prosecutions, but there are an incredible number of laws that are quite punitive in their scope and their reach. And try and set up a global movement that people can join in. So what is HIV criminalisation for those of you who don't know? We define it as the unjust and inappropriate use of the criminal law, public health law and policies against people living with HIV based solely on their known or perceived HIV status. Once again, as I'm saying, another example of the whole burden for containing this epidemic is always been placed upon people living with HIV. You know, it's an incredible burden that we have to carry rather than a shared responsibility. And I think that globally 129 countries have HIV-specific laws or apply general criminal law to people living with HIV for those things. And when we look at it, we look at a lot of those laws came about when we didn't know anything about HIV. We didn't know its route of transmission. We didn't know it was a fear of contagion, that from whatever population it started off in, it was going to spread into normal people. So there were knee-jerk reactions, both in terms of the HIV-specific criminal laws, and also there were applying general law principles very inappropriately and inadequately as hammers to crack something which actually wasn't really a problem, as you will see. I think, and please raise your hand if you disagree with any of these statements, because I'd love to hear, often an overreaction to zero negligible risk. Ignore up-to-date scientific evidence. You know, U equals U. You know, scientific consensus on transmissibility. Of course, laws are invented to use against people who the state wishes to control, and we know that they will often be overused against marginalised populations. In other words, a lot of the people sitting in this room and others. And yeah, it's driven. The way that they're enacted or put into place it's driven by homophobia, by gender inequalities, xenophobia, racism, and they all perpetuate HIV-related stigma. And to dig into that a little bit more, please, if anybody can give me any evidence that HIV-specific criminal laws or criminal prosecutions under general laws help prevent new infections, please tell me now, and I will go home and go back to being a a nice retiree baking cakes, but nobody can. But there is evidence that overly broad criminalisation of HIV, non-disclosure, exposure and transmission does all of those things and more. And this could have been 6 slides, you know, and I could have done it into all sorts of data, but I think hopefully these truths are self-evident, actually, in the 3rd, 4th decade of the epidemic. Or to say it another way, there we are. There's our old pal, Justice Edwin Cameron, actually saying it in the nutshell. It reinforces stigma. It makes it more difficult for people to access testing and prevention, and it makes it more difficult for people to talk openly about their virus to whom they need to talk to about it. I think it's even the people do not want to come under the purview of the law. Huh? They don't want to be pulled into that. So effectively, if you know there is a law in your country, or if you heard there's a law in your country that could put you under the purview of the law, you'll not come forward for testing. Because in some countries, knowledge of your HIV status and then doing certain things, actually doing certain things, having sex without telling your partner, even though the sex that you have is totally and absolutely safe, is in itself an offence. Huh? So why should I go and get tested, for example? And there are lots of examples of that. So there we are, the current state of HIV criminalisation as of 2023 March, as far as we know it. And you'll see there's HIV-specific laws, there are HIV-specific criminal laws, there are non-HIV-specific or similar laws, you know, all those in the purple up there. And there are a few good things where we've had repeal, or there have been no reported cases, and there have been some examples of reform. But effectively, it's a pretty bleak picture, isn't it? You can come under the purview of the law in all of those places in different ways. So if we look at, let's dig down a little bit further into Europe. And we will often say that we're doing a really good job in Europe, aren't we? Especially in the West, because we're up to date. We are not discriminatory. In some places we have equality acts like in the UK, but there are still reported cases where non-HIV specific or criminal laws have been used across most of Europe, there are still, as we move further east, there are still HIV-specific laws with reported cases. And of course, when I talk about cases, these are the ones we know about. Because it's very difficult to track. Because if it's a non-specific law, it will not go in any court gazette, you know. We'll be pulling it up from yellow literature and then trying to track it. You know, there's no centralisation, so we do that work of pulling these out. So, number one, this is a tip of an iceberg, we think, in certain senses. And also, for everything that is a prosecution that comes to fruition, what do you have lying underneath that? You have usually very ham-fisted, inelegant investigations into people, which damage and destroy people's lives, even if it doesn't go to court, you know? You know, where neighbours are told, where schools are told, where employers are told, oh, this person's HIV positive, and then we think that they might have done X or Y naughty thing. So, yeah, countries of Eastern Europe, just digging down into Europe, lead the charge in prosecutions. And we look at Uzbekistan, the Russian Federation, and Belarus. But what is really shameful in Western Europe is that there are still 3 EU countries that have HIV-specific laws on the book, contrary to UNAIDS guidance and what they've signed up to. Poland, Romania and Slovakia are the three. And I hope with the new government, thank you very much, that we have in Poland, which I think a big applause ought to be given to, you know, that the Polish people have actually thrown out that government and put something possibly slightly better in place. Hopefully that will change, as I hope an awful lot of other things will. But what can be done? And we work with strategic litigation. We work with parliaments or help people work with parliaments. And there has been some change to legislation. There has been guidance for prosecutors on training on judges, on what should be admissible in court, how things ought to be investigated in a sensitive way. But as Tenor said earlier, and used that horrible phrase, an enabling environment. Enabling environments at those top line sort of levels take a generation to have any effect. And yes, they need dismantling. But also I think that for anybody sitting here, know the law in your country. And you can do that by looking up the HIV Criminalisation database, which I'll talk about in a moment, and read the expert consensus statement on the science of HIV in the context of the criminal law. And when you look at that, whether you are an activist, a clinician, a researcher, and then you look at the policies and principles that might operate in your hospital, that might operate in terms of who you have to disclose somebody's HIV status to, of how you operate, see how actually that law and the existence of it actually might be consolidated or actually have ramifications of how it's stigmatatory and discriminatory in the practice that you work in. It's like the tagging of records. Because those are some of the things that have come out of those top-line knee-jerk responses, which are just as nasty and dangerous. And the wonderful Lara tells me I have 2 minutes and 54 seconds left, so I'm well in time. Good. And there is lots more, and I just wanted to give a very brief overview. So there's a simple conclusion. We cannot end the HIV epidemic until we remove HIV criminalisation. And policies, laws, but policies and practice, because they all flow down. Because they all harm HIV-impacted communities everywhere. So that's who we work with. That's a very light skim of the issue, but I would like to, for those of you who want some good bedtime reading and want to follow up on the issues, we think we have some really robust data that is open to everybody. We also have an HIV Justice Academy, which is an online, at your own pace training course in those 4 languages that will tell you, dig down all the way into HIV criminalisation, how it intersects with other social justice movements, what the standards of proof should be, etc., etc., etc. And it's good and authoritative, and please do sign up. We have a global criminalisation database that we've talked about before, and we produce a 2-yearly State of the World report on HIV criminalisation and what it does. We also have some beautiful videos of people's personal testimonies in relation to how they might have suffered from or actually banded together from all over the world to actually overthrow a piece of, or repeal a piece of legislation, and the community things that can be done. So I think that's it. Thank you very much. And I've still got a minute left, so I shall just flash this bag at you for a minute, and you can all be envious.